I'm Ryan Ray.
I'm Ryan Dyson.
And I'm Alex Davis. We chose Full Metal Jacket as a movie to analyze Private Joker, who was drafted into the United States Marine Corps. He helps Private Pyle, who is an innocent, incompetent Marine, who eventually snaps and kills his drill sergeant and then commits suicide. After Joker is deployed in Vietnam as a journalist, he records the horrors of war. Joker's squad is attacked by a sniper who kills multiple Marines. After seeing the sniper in his sights, he is unable to kill her, showing his lack of a killer instinct. Another Marine saves him from the sniper, and then he kills the sniper and gets the 1,000-yard stare, typical of a Marine who has seen combat.
We are diagnosing Private Joker with post-traumatic stress disorder, known as PTSD. This is an anxiety disorder that begins with a traumatic event that stimulates cognitive, emotional, and physiological symptoms. A person diagnosed with this disorder has been seen to re-experience of the emotionally disturbing events such as military action, rape, or even violent personal assault. This disorder affects approximately 3.5% of the American population. The most recent DSM-5 classifies PTSD under trauma and stressor-related disorders.
Joker displays symptoms of PTSD after witnessing Pyle kill himself in the restroom. After the death of Pyle, Joker faces combat and ends up killing a girl to avenge the death of his fellow troops. One of the symptoms is a negative self-belief of oneself, which relates back to Joker as he realizes he is actually born to kill. Another symptom Joker experiences is irritability when trying to order the remaining guys at the end of the movie. He struggles to control them even when he starts to get angry.
One symptom that Joker does not show are flashbacks through intrusive memories. It does not appear that the private relives the traumatic events as if it were happening or through upsetting nightmares throughout the film.
A possible treatment for PTSD is cognitive behavioral therapy and medication. Medications include Zoloft and Paxil, which are SSRIs, which work to increase the amount of serotonin in one's brain. Certain types of this therapy include prolonged exposure therapy and cognitive processing therapy. The projected long-term outcome is for patients to change thought processes over time and manage the thoughts as they arise. This process takes a couple months for patients to see results, though. This method of treatment is appropriate for this condition as experiences are talked about and patients find new ways to understand and live with them. Some ethical concerns for this type of treatment, however, include if it's appropriate to bring back graphic and disturbing thoughts during therapy, and also if it's appropriate to treat a soldier with prolonged exposure therapy and send them back into combat to experience more trauma.
PTSD is diagnosed after a traumatic event is experienced. And in Full Metal Jacket, we don't see Joker with as many clear PTSD symptoms as in other movies like Jarhead, because the movie ends without giving a picture of Joker reacclimated into society. However, it is very unlikely that Joker will develop PTSD from the events that happen in the movie, and it is possible to see symptoms of PTSD in the movie. Mental disorders in movies aren't the most important thing about the public's perception of mental disorders. That responsibility falls on education. However, because movies are easily accessible, they can influence public perception. However, most mental disorders in movies work under a suspension of disbelief and are not completely accurate. The disorder is not diagnosed in all cultures. PTSD is not diagnosed, especially in military culture when you're deployed. And there's a stigma that people with PTSD are dangerous or violent, and that is not true.
And these are our sources.